Thinking about starting a family? Or maybe you just got that positive pregnancy test? Congratulations! It's an exciting time, and one of the very first things on your mind is probably how to best support your health and your baby's development. That's where prenatal vitamins come in. But with so many options on the shelves, how do you choose the right one? Stick around, because today we're cutting through the confusion. Hey everyone, and welcome. Mom and Baby Care channel, and glad you're here. Choosing a prenatal vitamin can feel like a huge decision, and honestly, it is an important one. Prenatal vitamins are specially formulated supplements designed to fill nutritional gaps and provide the essential building blocks your body needs during pregnancy, often even before you conceive, to support a healthy baby. They are more than just a multivitamin. They contain higher amounts of specific nutrients crucial for pregnancy. So, let's break down what you really need to look for. Alright, let's get into the nitty-gritty. There are a few non-negotiable nutrients every good prenatal vitamin should have. First up, and arguably one of the most critical, is folic acid, or its natural form, folate. This B vitamin plays a massive role in preventing neural tube defects, which are serious abnormalities of the brain and spinal cord in your developing baby. These defects can happen very early in pregnancy, often before you even know you're pregnant. That's why it's often recommended to start taking it even if you're just planning to conceive. Next is iron. During pregnancy, your blood volume increases significantly to support your baby, and iron is essential for making hemoglobin, the protein in red blood cells that carries oxygen to your tissues and to your baby. Iron deficiency anemia is common in pregnancy and can lead to fatigue for you and potential issues for baby's growth. Most prenatals contain around 27 mg/mg of iron. Some women find iron constipating, so we'll touch on managing that later. Calcium is crucial for building your baby's bones and teeth. If you don't get enough calcium in your diet, your body will take it from your own stores, which can affect your bone health later on. While prenatals contain calcium, they usually don't have the full recommended daily amount, around 1,000 to 1,300 milligrams for pregnant women, because the pill would be too large. So, focus on calcium-rich foods too, but your prenatal should give you a good boost, typically 200 to 300 milligrams. Vitamin D works hand in hand with calcium to help build baby's bones and teeth. It also plays a role in immune function. Many people are deficient in vitamin D, so it's an important one. Look for at least 600 international units, IU, but many experts now recommend higher doses, even up to 2,000 to 4,000 IU. Again, your doctor can advise. Beyond those core basics, there are other nutrients that are incredibly beneficial. DHA is an omega-3 fatty acid that is absolutely vital for your baby's brain and eye development, especially during the third trimester. Not all prenatals include DHA, so you might need to look for one that does or consider a separate supplement. Aim for at least 200 to 300 milligrams of DHA per day. Iodine is crucial for healthy thyroid function in both mom and baby, and it plays a significant role in fetal brain development. Many women don't get enough. The American Thyroid Association recommends pregnant women take a prenatal containing 150 mcg of iodine daily. Okay, so you know what to look for. Now, how do you find it? It's all about reading that label. Check dosages. Compare the amounts of the key nutrients we discussed with the recommended levels. Serving size. Is it 1 pill a day, or 2? This affects how long a bottle will last. Source of nutrients. Some vitamins come in different forms, for example, folate versus folic acid, or different types of iron which might be gentler on the stomach. If you have specific concerns, like MTHFR gene mutation, discuss this with your doctor as you might need a specific form like methylfolate. Other ingredients, fillers. See if there are any artificial colors, sweeteners, or allergens you want to avoid. Third-party testing. Look for seals from organizations like USP, NSF, or Consumer Lab. This indicates the product has been tested for purity and potency, meaning it contains what it says it contains and isn't contaminated. Beyond the nutrients, practicality matters. Some prenatal pills can be quite large. If you have trouble swallowing pills, look for smaller options, coated tablets, or even consider gummies or powders. However, be aware that gummies often lack iron or have lower amounts of certain nutrients, so check the label carefully. If you're struggling with morning sickness, the thought of swallowing a vitamin can be tough. Some tips. Try taking it with a small snack, or right before bed. Some prenatals are formulated to be gentler on the stomach, perhaps with ginger or a different form of iron. Again, gummies might be an option here if your doctor approves the formulation. Prenatal vitamins vary in price. More expensive doesn't always mean better. Focus on getting the key nutrients from a reputable brand. Your doctor might also be able to recommend affordable options or even prescribe one. So, when should you start taking these? Ideally, you should start taking a prenatal vitamin at least 1 month before you begin trying to conceive. This is especially important for folic acid to do its job in preventing neural tube defects, which form very early. If you've just found out you're pregnant and haven't been taking them, start as soon as possible. And now for the most important tip of all. Talk to your doctor or midwife. They can assess your individual health needs, any pre-existing conditions, your diet, and recommend the best prenatal vitamin and dosage specifically for you. They might even have specific brands they trust or samples you can try. Alright, let's quickly recap. When choosing your prenatal, focus on key nutrients, folic acid, iron, calcium, vitamin D, and consider DHA and iodine. Read the label. Check dosages and serving sizes. Your needs, pill form, nausea considerations, and third-party testing. Timing. Start before conception if possible. Doctor's advice. Always consult your healthcare provider.